Hello, and welcome to Spokane County Spotlight. I'm your County Commissioner, Josh Kerns, and my guest today is Dr. Frank Velazquez, Interim Health Officer for the Spokane Regional Health District. As you may expect, our focus today will be about the COVID-19 pandemic. As we settle into a new year, our focus for this program will be discussing our response to the pandemic and the steps that are being taken to recover from the damage done in the last year. Dr. Velazquez, welcome to the program.
Thank you. My pleasure being here. Thank you, Commissioner.
Yeah, as we get started, could you give our audience an introduction about yourself, a little bit about your background?
Sure. Well, it'd be my pleasure. So I'm a little bit of a mystery to a lot of people. So I'm a physician and have been so for about 35 plus years. Won't tell you what the plus is, makes me look old. But I've had the opportunity to have 3 careers within my practice. I had a full clinical career, took care of patients early on, particularly cancer patients and HIV patients, and was responsible for one of the early testing programs in the country, actually, many years ago. As a complementary career, I did a lot of teaching in medical school, in 5 different medical schools for about 25 years. Mm-hmm. So I'm a full clinical professor and former departmental chair. So I'm a former academic chair. I'm a recovered academician, I guess probably the best way to look at it. So as I was doing all of that, I chose to go back to school many years ago when I was still in New York, and I was a chief of service, president of the practice plan, and academic chair. Went to Harvard School of Public Health and got a master's in healthcare management and policy. And the reason for that school is because of their emphasis on public health and policy. And probably a little known fact, most people in Spokane probably don't know that, when I finished that, I took the LSAT, applied to law school and got into law school because I was very interested in health policy. But I did get a great job offer to work with a great academic health system in Texas, so I deferred my admission. So after that, I became more of a full-time executive. And I've run 3 large companies over the last 12, 15 years, last one being PAMO. When I was in California, actually one of my companies, the manufacturing side of one of my companies developed the first H1N1 test in the country. And we also used to run all the clinical trials for infectious diseases. So I've been around infectious diseases for the better part of my 35-year career in one way or another.
Wow.
So brings me to Spokane when the company was acquired. Mm-hmm. They asked me to join and be the chief medical officer, but that required a move to North Carolina. Beautiful state, but my wife and I said, no, we're staying in Spokane. So stayed here and been volunteering for the last 3 years for the most part.
All right, fantastic. Could you give our audience an overview of the roles and responsibilities of the Spokane Regional Health District?
Sure, and I think that's a great question because I do believe that for many of us, the Regional Health District is a little bit of a mystery mm-hmm. in terms of how much it does. So we're organized in 6 different divisions. One of them has the administrative function, but the other 5 are programmatic in nature. And those include community and family services, disease prevention and response, environmental public health, treatment services, and health promotion. And the breadth and depth of those services goes all the way from childhood dental health to COVID response, environmental health, and everything else in between. I will encourage everybody in the community to go to the website and really look at each one of those programs because each one of those has 20, 25 different services that are of great benefit to the community, and many of us were not aware of all of that.
Yeah, no, I couldn't agree with you more. There's so much, there's such a huge breadth of things that the health district is involved in. Yeah, I think a lot of folks, if it's not something you deal with on a daily basis, you wouldn't necessarily know that it's the health district that oversees sort of that specific item. So I couldn't agree with you more to check out the Regional Health District's website. A lot of great information there.
Thank you.
As we enter into January, where does the county sit as far as exposure to the COVID-19 virus?
That's a great question. So I'm going to go back a little bit before that to give you a little bit of context. So we had a lot of conversations around the beginning of the holidays before Thanksgiving about being careful and stay with your household. And as we moved into mid-December, 15th through the 18th, we started to see the numbers go down a little bit. And they remain kind of steadily going down, not plateauing and going slowly down, but it was a good trend, which continued through kind of like the end of the year. We saw a little bit of an uptick at the beginning, but I do believe that we are on track, if we all really follow the public health guidance for the holidays, to continue that trend into the future. Right now we have about 27,000 cases with about a 5% hospitalization rate. The reason why that is important is a vast majority of people that do get infected have minimal symptoms or are asymptomatic, although we do worry about those that require hospitalization, as well of course, there's a certain amount of mortality. But if we continue doing what we need to do, and with all of the things that we have inside, I think 2021 is going to be a much better year than 2020.
All right. With what you just explained about the case levels, how has that impacted the operations at the Spokane Regional Health District?
Well, that's a great question, because all of the programs that we have are still running, are still in process. So we've just added a massive amount of work to pretty much everybody in the health district. It's about over 250 people. So they're still doing all of their jobs, plus all of the COVID response. Of course, we've had some additional resources, but it is amazing how the staff has been able to flex up and realign. And we're constantly realigning to make sure that the resources are there. So it has been a challenging time. And I think it has been a challenging time because, as far as I can tell, at least I've never seen anything like this in my professional career. Most people I know that are my age have never seen anything like we've seen. And with all of that, the response of the Regional Health District has been astronomically good, has been amazing, and continues to be amazing. And actually, that's my biggest worry, that they've been running really fast, really hard for over 10 months. And I keep telling them, I worry about you, you need to take a break, which is hard for these folks to do.
Yeah, I can speak from experience that there is a lot of hardworking staff that you have down there. You got a great team down there, for sure.
We do. Thank you.
Yeah. What would you say is the most important message that you would like to share with the citizens of Spokane County?
Well, great question. There's a couple of things I would like to share. First of all, thank you for not only everything that the community has done to help manage this pandemic, but also for everything the community has done to help each other. I think we've seen neighbor helping neighbor, friend helping friend, family helping family, strangers helping others. So I think that's number one. I think number two, that we still have a little bit of work to do because the pandemic is not over, but we're on track to manage this a lot better this year. And then number three, there's a really, really big light at the end of the tunnel, which was very tiny 6 months ago. It's a lot bigger now because we have vaccines that are moving forward. We have more testing that we're going to see. And the good news is people are still following, as they should, the public health guidance, because we're going to need to continue washing our hands, wearing the facial coverings, and taking some precautions as we go forward. So the message is, job well done, a little bit more to do, and you know what? There's light at the end of the tunnel, we're going to get through it.
Yeah. Yeah, you mentioned neighbors helping neighbors, people working together. Who are some of the community partners that have helped you and the health district achieve its mission?
So it's been an interesting experience to see the level of collaboration that this pandemic has generated, not only with us, but around us and in the community. So we have our healthcare partners, we have other agencies, we have a number of nonprofits, we have volunteer services, we have community groups that have come to say, hey, how can we help? We have individuals. So the level of collaboration that we have is at so many levels that is quite amazing. It's something that I think is important to acknowledge, because it's all-inclusive. It's not just one part of the community, it's the whole community. And I think that's how we, as a community, really will conquer this particular challenge.
You've been involved with so many organizations and nonprofits in our community. Could you share with us a little bit of your experience and what some of those organizations are that you've worked with?
Sure. And one of the things we found out when we moved to Spokane and spent a little bit of time in Spokane is that if you're willing to help, people will welcome you with open arms. So being the person that I am, which I like to help and I like to get involved, I'm on a lot of organizations, but all of them are around either education, health sciences, better access, better care, and or services for the community. For example, I'm the incoming chair for the board of United Way.
Okay.
But I'm also president-elect for the board of the Symphony. So I'm in a number of boards, but all of them are about how do we give back to the community, how do we provide what the community needs, and how do we provide a line of sight for those that are coming behind us to have a better opportunity than we did. So I could actually lump all of them into those categories, and it's very, very consistent. So healthcare, life sciences, education, arts, culture, and services for the community. Those are the three buckets. And I'm in 14 boards, I think.
Well, certainly brings a level of knowledge for the community that I would assume is extremely beneficial to your role as Interim Health Director as well. When we look at the health district as a whole, what type of support do you get from local governments and other community organizations or nonprofits?
So we get tangible and intangible support, and it's all important. Obviously, we get some funding, which is always important, as well as resources. But we also get support on our quest for either services, partnerships, or additional funding for specific areas. So we have a lot of support, and actually I think is appropriate for the community as a whole to be supportive. So we're very grateful for that, because the only way we can actually do what we do.
Okay, yeah. With all the uncertainty that our citizens experienced through 2020, were there any high points that weren't covered in the media that you'd like to highlight today?
So I think we tend to focus a lot on statistics and numbers as opposed to some of the intangible things. And one of the things I've always told people is we always should focus more on the hope. There always has to be some hope. Human beings, we need hope, and there's a lot of that. There have been a lot of amazing stories about people helping people, organizations helping people in the community helping itself, that I will have preferred that we spend a little bit more time, because it gives you something to look forward to, and it gives you something that is positive and says, you know, this is difficult, but we'll get through it. Yeah. So that, and it's not a criticism, by the way, it's just more of an observation about things that if I had the power to do that, I would probably have spent a little bit more time on that.
Okay. In your short time with the Spokane Regional Health District, what most surprised you about the organization?
So I'm going to use a different word.
Okay.
What most impressed me.
Okay.
Within my first 10 days, the people. I came in knowing a little bit about it, knowing a little bit about the function, and I found myself surrounded by extremely talented, extremely dedicated, very passionate people that care, and care to a level that sometimes I keep telling them, you need to take care of yourself too. Because if you don't take care of yourself, you can't take care of it. But the people is something that surprised me. And I made it a point of making sure that the community knows that. Because something that sitting on the community side until about 2 months ago, I really didn't know. The depth of knowledge, the depth of experience, and the passion and the commitment. I knew a little bit about it just because some of the programs and some of the impact, but when you get in, it's that's the thing that impressed me and the most, the people.
Okay, all right. If somebody in our community thinks that they have possibly come in contact with somebody who has COVID, or they start showing symptoms themselves and they want to get tested, where would they go for information on how to do that? Where would they go to actually be tested?
So that's a very good question, and they can always go to our website. We have a lot of information about that. But the good news is that the community and our community partners have responded by expanding our testing capacity as a county. So we have this drive-through clinic that the Arena, which is a collaborative effort that Chaz has been leading. We just opened up a site closer to the valley from Providence. So if you look at our healthcare systems, have testing that is available through their urgent care centers. Walgreens and others have, so there's a fair amount of testing that is available for individuals that either think they may have been in contact with or have symptoms. I always put the caveat though, always consult with your primary care provider before you do any of that, because it may be appropriate or may not be appropriate. So there are a lot of options, but always consult before you do that, because tests have repercussions and consequences, and we need to know how to manage that. And you don't want to perhaps infect others.
Yeah, yeah. And now I know early on, when we roll the clock back or the calendar back, 8-9 months, we were at a time where the number of tests or the medium to transport the tests was lacking. Are we past that time now? I mean, do we have a sufficient amount of tests for our community?
Well, at this point in time we do, but there's always a concern about the supply chain in the event that we have surge in the numbers. But right now, all of our laboratories, all of our diagnostic providers are well stocked, have the supply chain. The early days of we don't have enough transport media, we don't have any swabs are pretty much gone, but we're always diligent and mindful of that and keeping that in mind to make sure that we don't suffer from the same issues. But at this point in time, the improvement has been dramatic.
Okay. What would you say is some of the most important things that we can collectively do as a community?
So I think there's a couple of things that we can do as a community. One is please do follow the public health guidance. I know it's been a long time and I know we're all tired, but a little bit more effort for the next few months I think will go a long ways. That's number one. Number two, if you qualify and are able and have access and your provider allows you to or tells you you're eligible, get the vaccine. Okay. Because we do get to get immunized. And then the third is more of let's keep up the neighbor helping neighbor. There's a lot of volunteering opportunities that if you have time will be helpful to the community. And that helps build resilience. There's been a lot of studies that one of the ways you build resilience is by doing something for someone else. Helps you manage the stress. So those are the things that we can do as a community.
Okay. You touched on the vaccine, and I know that there's still a lot of unknowns, as far as supply chains or number of doses that are out there. But what is sort of the long-term goal or information that you can share with us about the vaccine today?
Sure. So when I started this job, I kept talking about the vaccines on the horizon. Now we have them; they're here. We have 2. There's 3 or 4 more that are in various stages of clinical trials. We've dispensed over 26,000 doses thus far in the county, and we're anticipating weekly or every other week shipments for the duration of this. And our goal is to keep immunizing until everyone that qualifies and everybody that wants a vaccine has one. Now, I have said that, but I want to make sure that we all understand that it's not right now. Right now, we're focused on high-risk healthcare providers, first responders, and really high-risk individuals. Example, our senior citizens in some of the long-term care facilities. And that's phase 1A, so there's 3 phases. And we will get through all of those. With the advances in vaccine and vaccine manufacturing, I'm confident that we will have enough vaccine for all over the next several months.
Okay. And I would say the best place to stay up to date on that information would be the Spokane Regional Health District's
Absolutely.
website?
Not that I'm trying to do a public service announcement, but that is the best place to go. The Department of Health for the state of Washington also has some good information. And between those two, you pretty much can answer every question you might have.
Okay, okay. Is there any other information about about the vaccines that people should know about, or?
There's a couple of things about the vaccines that I think are important for all of us to be aware of. One is we did manage to move very fast in manufacturing this vaccine because we derive benefit from 15, 20 years of research and development in technology that has been used for the last 10 years for a variety of other things. That allowed us to really move a lot faster than we ever have. We still enrolled tens of thousands of people in the trial, so every step was followed. And not only that, but each one of the vaccines that is in front of us right now basically had 3 checkpoints. The company and their experts look at that, the FDA and their experts look at that, and the state of Washington and their experts look at that, and they all went like, great, 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 which is what we have in front of us. So I want people to feel comfortable with the notion that there were no shortcuts in the production of this vaccine. It's as safe as any other vaccine. And I made a comment one day that maybe even safer than others. And what I mean by that is the 2 vaccines that we have in front of us, neither one of those has any of the live agent or attenuated agent. So you're not exposed to the virus at all, which is one of the ways we immunize people. So they're safe, and like any other vaccine, there may be some minor side effects or some other side effects, but as always, consult with your primary care provider, and if you have the option, I will do it, and I'm recommending to all my family and friends that if they have the option, to please get immunized.
Okay. Well, in our final few moments, is there any other messages you'd like to share with our audience today?
Well, I'm the eternal optimist. So I do want to share with the community that we've done a good job thus far in a very tough situation that none of us had any experience with. Let's keep that up. Let's stay hopeful. Let's stay positive. And 2021 will be a much better year.
Okay. All right. Well, Dr. Velazquez, I want to thank you very much. I've enjoyed our conversation today, and quite frankly, I think our audience has too. But I'm afraid we are out of time.
Well, thank you for the invitation.
Oh, absolutely. Again, I would like to thank my guest, Dr. Frank Velazquez from the Spokane Regional Health District. As a reminder, a video of today's Spotlight can be accessed on our Spokane County homepage or on our Spokane County YouTube channel. You can also listen on the go by downloading our Spokane County Spotlight as a podcast on either SoundCloud or iTunes apps. Just go to either of those app stores and search Spokane County. I'm your County Commissioner Josh Kerns, and thank you for joining us today on Spokane County Spotlight.